Hi, my name is Lily Fulton.
And I'm Julianne Young, and this is our continuing education video. Today we'll be covering breast cancer-related lymphedema, and we'll be instructing you on how to use the volumetric edema gauge to assess the level of edema in an upper extremity. And then we will show a technique for KT taping that helps with edema and managing lymphatic drainage. Breast cancer-related lymphedema, or BCRL, remains a significant clinical issue for breast cancer survivors in that it causes severe physical and psychological discomfort. Both axillary surgery and radiotherapy can cause lymphedema with significant impairment of the lymphatic drainage. This produces an abnormal collection of protein-rich fluid within the upper limb. The common subjective clinical symptoms of patients with lymphedema in the upper limb include swelling, numbness, heaviness, tightness, stiffness, decreased coordination and mobility, limb fatigue, and weakness. Objective clinical signs include skin changes such as reddening, hyperkeratosis, thickening, or firmness of the tissues. Symptom presentation is broad, and not all patients experience the same symptoms. According to reports, the incidence of BCRL varies and is approximately 20% at 1 year and increases to 40% at 10 years after breast cancer treatment, with a cumulative incidence of 28%. Lymphedema can develop within days post-operatively and can continue to present until 11 years after breast cancer treatment. Between 5 and 17% of people who have sentinel lymph node biopsies in which surgeons remove 1 to 3 lymph nodes develop lymphedema. For people who have axillary lymph node dissection in which 10 or more lymph nodes are removed, the percentage jumps between 20% and 53%.
So looking at the relevance to occupational therapy, it's important to get a certificate or specialize in lymphedema when you are looking to serve that population. So a certificate would be a CLT, which is Certified Lymphedema Therapist, and then also sometimes you'll see a CLT-LANA, LANA, which stands for Lymphology Association of North America, which is just kind of like a second tier of training. So again, it goes a little deeper, further than the CLT itself. They do certificates through AOTA, and there also are a bunch of other resources out there on the internet that you can specialize and get your certificate in lymphedema. It's important as an occupational therapist or as a future occupational therapist for us to educate our patients on how to look at lymphedema after breast cancer treatments. Some things that we can educate our patients on are changes in their skin, so looking at tightness, itching, rash, redness or hardening, achiness, tingling. There can be underarm sensation of fullness, heaviness in the arm, hand, breast, chest, or the underarm. OT will be involved after post-surgical precautions to educate their patients and to prevent symptoms from occurring, or if there already are some of those symptoms occurring, say after radiation or chemotherapy, that we can step in and be able to assess and create some personal interventions for that patient. And then looking at some risk factors, a lot of times it's after surgical procedures that this can occur. Lymphedema can occur after breast cancer procedures. So these can include mastectomy, so that increases the risk of lymphedema more than a lumpectomy. Experts also believe that having multiple chest surgeries, either to treat breast cancer or another condition within the chest, can disrupt the lymphatic system and increase the risk of lymphedema. So just educating patients, letting them understand that can happen. Then lymph node removal during breast cancer surgery can also increase lymphedema, and the risk increases as more lymph nodes are removed. And then radiation therapy, like I said, and chemotherapy can also be risk factors, and then also carrying extra weight. So people who carry that extra weight have an increased risk of developing lymphedema after breast cancer treatment. So that extra fat can put pressure on the lymph nodes and vessels, and the extra pressure may affect the lymph flow and drainage, therefore leading to lymphedema. So what we're going to be doing today is we're going to be simulating what an OT would do during an intervention for a patient that has lymphedema associated with the breast cancer, whether that be post-treatment, whether it be radiation, chemotherapy, just whatever route they chose as their patient. So we're going to start with an assessment using the volumetric edema gauge, and we'll show you what that looks like in a moment. And then we're also going to follow up that with an intervention. So we're going to be using KT tape today to show drainage of edema in the upper extremities. And then we're also going to be ending on a quality of life assessment. So just looking at a questionnaire, looking at the patient's overall quality of life and how lymphedema has affected them and their social, physical, and mental health. And so that way we can address and personalize their interventions to help them the best that we can within therapy. Okay, so this is the volumetric edema gauge, so just kind of giving us a baseline of the affected versus the non-affected arm and showing us how much lymphedema is in the arm. So what I'm going to have the client do is we're going to start with her affected arm, and you always want to fill the water to about right underneath where this little pipe comes out, just so it's not coming out of the pipe, but it's still at a good measurement. Okay, so then we're going to take the affected arm. So for this purpose, we're going to be holding some markers to show what it would be like if she did have lymphedema. She could just slowly put it in the water. And there is a little bar in there, and she's going to place her fingers on top of the bar to rest on the bar, in between her middle finger and her ring finger. So the bar will be sitting about right here. So that's how she knows when to stop. And then bring your hand out. Nice. Okay, and then we're going to take the water that did drain and we're going to put it into our measurement tube. And so for the affected arm, we've got about 280 milliliters. And so we'll have to document that. And then for the same patient, for the purposes, we're just going to pour the same water back in. But, if this were in a real clinical setting, you would use fresh water if it was another patient for hygiene purposes. So now we're going to take her right upper extremity and do the same exact thing. Just having that hand go in slowly and the bar go in between the middle and the ring finger. And then just hold it until the water stops. Perfect. Okay, and then we'll take the water that drained and we'll pour it into the measurement tube. And for the unaffected arm, we have a little under 200, about 180 milliliters. So for this purpose, you can then compare the affected arm versus the non-affected arm, and then as you are doing your interventions, you're able to measure the progress of the lymphedema drainage.
So following our assessment, we are moving on to intervention, and we have chosen to show KT taping. So KT taping, it's a great intervention to use for lymphedema because of its effect on the flow of lymph. So it does this by lifting up the skin and allowing for the better flow and the removal of swelling from the area. This intervention is great to use in conjunction with other conservative modalities like manual lymphatic drainage, which we could use before this, and we could tape them before they leave for the day. To use this intervention, we have to be able to understand the pathways of the lymphatic system so that we avoid causing more harm than good when using KT tape. So to start, we have already prepped the skin You want to do this so that it's free of lotions and oils that we may have used for the manual massage. So we have this strip here, it's called a fan strip. So we have this part over here, which we're going to attach on her unaffected side. And then all of these strands will go across her chest, and they will act to kind of pull the skin that way to allow for more drainage in the axillary area. And then when you're applying this one across the chest, you're not going to want to do more than 10 to 15% of stretch. It's a very light stretch for this piece. Okay, so then for her affected arm, I've already cut up a piece for her arm, but I'll show how we cut KT tape. I'm just gonna measure another strip the same length. And then we always want to make sure we are rounding the corners. This just makes it so the tape doesn't lift up as easily or as quickly. And then we're going to do another fan strip. So we're going to cut 4 strips up this piece. So there we have all 4 of our strips of our fan piece. And then you're also going to want to round the edges of all of the strips. So now that we have our fan piece cut up, we are going to start with a piece on the front of her arm, and it's going to go down to about her elbow. So we are going to attach the top of our piece here, and then these are going to fan down. And again, this is very light tension. We only use very light tension for edema. So for the tension, it's basically just going to be taking the paper off a little bit, and we're just going to lay it down. And then we're going to do the same thing, and we're going to do it on the back side of her arm. All right, so this is how it will look with the 1 strip across her chest and then the 2 across her arm on her affected side.
So following the intervention with the KT tape, it's good to follow up with the lymphedema chronic venous edema patient questionnaire with your patient. This questionnaire will have the patient look at a set of questions, and they will circle the number that best describes the intensity of the experience or feeling of the question being asked. The questions are aimed at the lymphedema and how it affects their social, physical, and mental health. A couple example questions being, currently, does swelling limit your work or involvement in the care of your home and family? And the options will be numbers 1 through 5, 1 being not at all and 5 being a great amount. So 5 being impossible to do, and then, or absolutely. And then another question being, to what extent does your lymphedema swelling make you feel like a handicapped person? So 1 being not at all, and then 5 being a great amount, absolutely it does.
BCRL is a debilitating and chronic condition that can severely affect the patient's quality of life. It can limit their ability to engage in daily activities, self-care activities, work, and social interactions. This impact can also reach much broader into the community as well, which is why we would like to focus on addressing their quality of life to ensure we are providing as holistic care as we possibly can.